Welcome to the module Preventing the Spread of Candida auris, a frontline forces training presented by Superior Health Quality Alliance, or Superior Health. This learning module was developed for direct caregivers working in multiple healthcare settings who care for a variety of patients. It is also relevant for family members caring for a loved one in the home. Direct caregivers play a very critical role in providing care to individuals in many settings of care. Why? Because direct caregivers spend a great deal of time with their patients, which helps them to know and better understand the needs of these individuals. The purpose of this course is to either introduce you to or further your learning and build on your current knowledge about Candida auris. What you know and how you use that information improves the quality and safety of the patients you care for. This learning module, Preventing the Spread of Candida auris, is part of a series of modules exploring Candida auris. You're viewing the second module of the series, which provides information about preventing its spread. It is not necessary to complete the entire series of modules in one sitting. You can leave and return to any of the modules at any time. The third module in this series, Managing Candida auris in a Care Setting, is directed toward licensed staff. Once you've completed this learning module, you may test your knowledge and understanding of the material by completing the quiz. Upon completion of this module, you will be able to identify how Candida auris is spread and describe methods to prevent the spread of Candida auris, commonly called C. auris. In the rest of this module, I will be referring to Candida auris as C. auris. Though much work is still needed to further understand how C. auris is spread, we know that it can be spread in healthcare settings through contact with contaminated environmental surfaces or equipment, or from person to person. C. auris is a fungus that can cause serious infections. It can spread from one patient to another in hospitals and nursing homes or other healthcare settings. Patients can carry C. auris somewhere on their body, even if it's not making them sick, and this is called colonization. When people in hospitals and nursing homes are colonized, C. auris can spread from their bodies and can get on other people or nearby objects, allowing the fungus to spread to people around them. The percentage of those patients who are colonized with C. auris that will go on to develop invasive infection is not known. As was mentioned in the first module of this series, C. auris is a real concern because it causes serious infections. C. auris can cause bloodstream and other types of invasive infections, particularly in patients in hospitals and nursing homes who may have many medical problems. More than 1 in 3 patients die within a month of being diagnosed with an invasive C. auris infection. It is often multi-drug resistant. Antifungal medications commonly used to treat other Candida infections often do not work for C. auris. It is also becoming more common. Although C. auris was just discovered in 2009, the number of cases has grown quickly. Since 2009, it has been reported in dozens of countries, including the United States. It is difficult to identify C. auris. It can also be misidentified as other types of fungus unless specialized laboratory methods are used. And finally, it can spread and cause outbreaks in healthcare facilities. Just like other multi-drug resistant organisms, C. auris can be transmitted in healthcare settings and cause outbreaks. It can colonize patients for many months, persist in the environment, and withstand some commonly used healthcare facility disinfectants. Healthy individuals do not usually get sick from C. auris. Those that are at higher risk for a C. auris infection include individuals with longer hospital or long-term care facility stays, particularly those with open wounds, tracheostomies, or invasive devices like ventilators or urinary catheters. Since patients or residents colonized with C. auris may not be showing any symptoms of the illness, it is important that good infection prevention and control practices are used with all persons you care for to prevent its spread. Careful attention to infection prevention measures such as hand hygiene, the proper use of gowns and gloves, thorough environmental cleaning, and the use of dedicated equipment and supplies can help reduce the risk of transmission within healthcare facilities. If a patient or resident has a Candida auris infection or is found to be colonized with C. auris, it is also best that they stay in a private room to help prevent its spread. For all persons you care for, you should perform hand hygiene before and after changing dressings, providing patient or resident care, such as bathing, dressing, or changing linen, and accessing indwelling devices, such as urinary catheters. Hand hygiene should also be performed before preparing or eating food and after using the bathroom. Patients or residents should also be encouraged to perform hand hygiene often. One reason that C. auris is of such great concern is that it has evolved to be resistant to many cleaning products. Because healthcare settings are disinfected so frequently, they can be the birthplace of bacteria or fungus that are resistant to cleaning products and to treatments. Thorough and increased frequency of cleaning in healthcare facilities, including all patient and resident care equipment, is important because the C. auris fungus can live on surfaces for several weeks. The products registered for use with C. auris are included in the EPA list linked on this slide. EPA has reviewed laboratory testing data demonstrating that these products kill C. auris. A product's effectiveness can change depending on how you use it. Disinfectants may have different directions for different pathogens, so it is important that you follow the label directions for C. auris, including the contact time. Ideally, to prevent the spread of C. auris as well as other infections, it is best to use single-use disposable non-critical equipment or dedicate equipment to one patient or resident. If that is not possible and equipment is shared, it is important to disinfect all patient and resident care equipment after use with a product registered for use with C. auris following the label instructions. Congratulations! You have successfully completed this module. It is now time to test your knowledge by taking the quiz. Click on the link for Preventing the Spread of Candida auris quiz on the Frontline Forces webpage or in the YouTube description below. For further information, refer to the references on these slides.